Well, good morning, Houston. This is Community Health Choice on Community Care Show on your amazing 102.5 FM.
Yes.
I am your host, Lance Jones. Am I sitting on my right side this morning?
It's Destria Horton.
Good morning, Destria. How was your weekend?
It was a great weekend, Lance. It was a great weekend.
It was a nice one. Folks didn't know that we were thinking we were going to be off today because we were going to share the winnings.
Yes.
But we are here.
We are here to still keep informing the people of Houston about the great things that healthcare has to offer.
Yeah, we have a very packed show this morning here. We have Dr. Cordell in our first half that is going to provide information on prostate cancer. Our second half is going to talk about the importance of immunization. So it's a packed show today.
It's a packed show, yes. A lot of knowledge. Great to have both leaders on, and they're both active in the community, so I can't wait to hear what they have to say.
All right, before we begin, why don't we give them a little bit of how they can reach Community Health Choice for their healthcare needs.
Well, you can always reach Community Health Choice at 713-903-7638. Again, you can reach us at 713-903-7638, and one of our friendly representatives will be waiting to answer any of your healthcare needs questions.
Yep, and check us out on our website at www.communityhealthchoice.org. Remember, the mission of Community Health Choice is to improve the health and well-being of underserved Texans by opening the doors to healthcare and health-related social services, and that is what I think a good intro, Dr. Cordell.
Thanks for having me.
Good morning. How are you?
Thank you. Very well.
Good morning. So with us this morning, as Lance has stated, we have Dr. Cordell Nwokeji. He's with us. He graduated with a bachelor's degree in biology from Colgate University in Hamilton, New York. He went on to earn his medical degree at Howard University, College of Medicine in Washington, D.C., and he completed his urology residency at Southern Illinois University in Springfield, Illinois. Dr. Nwokeji specializes in general urology with an emphasis in minimally invasive prostate cancer therapy. And I am one that can attest that he's wonderful at what he does because he is my husband's urologist, and he led us on our journey through beating the fight of prostate cancer about a year ago.
Wow. Well, this is a good time. This is September is Prostate Cancer Awareness Month.
Correct.
Yes.
So why don't you share with the audience why it's so important that you're here today, or why you're here today?
Well, thank you, Lance. I really appreciate it. My name's Cordell Nwokeji. First and last letter is so, and I always tell patients it's like a brokage with the wokage. That's right. I do appreciate it. You know, prostate cancer is one of those diseases that is really not talked about. It's a sleeping giant in the community, especially amongst African Americans, but in general in the male community. It's the second leading cause of cancer death in men. Wow. Second cause. Now, everyone knows lung cancer is a killer. Everyone knows that. That's number one cancer cause of death in men. Colon cancer or colorectal cancer is number 3 cancer leading cause of death in men and women. Breast cancer is number 2 cancer killer in women. Prostate cancer is number 2 in men, but people don't talk about it. So that's why I'm here today, to put some light to the fact that this is a silent killer in our community.
Wow. When you hear those statistics, the way he just broke that down, it hits home a little differently because, you know, it seems like we're always following the pink, but prostate cancer is the blue, and you don't see as much awareness, in my opinion, you know, when you see commercials or things out in cities when people are advertising it. I wonder why.
Even NFL teams wear pink in October, but no one wears blue in September.
Do you think that has anything to do with, and I don't know if there's a different percentage of men that are traditionally yearly going to have physicals versus more women are more likely to have that?
I always say it's a man thing. Men don't talk. Mm-hmm. Now, if you diagnose a woman with breast cancer, she tells her hairdresser, she tells her friends, because they talk. Mm-hmm. Women talk. They're more attuned to talking about their health. Mm-hmm. With men, it's almost like a taboo. Mm-hmm. They might not even tell their brothers. So it's a thing where men really don't like feeling vulnerable. Mm-hmm. I always say, it's a little joke I give, but it's a true joke. The thing that brings a man to the urologist are 4 things: PPW and PPP and W. Pain, penis, blood, B, and the wife. Those are the 4 things that brings a man to the doctor. And if they don't have those things in place, it's unfortunate. By the time they see us, it's too late.
Wow. Does prostate cancer have any type of symptoms? Like, how would a man even?
That's a problem. It's a silent killer.
Yeah,
a lot of times the early symptoms you don't. It really has no early symptoms. The prostate, or when men get older, they start having problems peeing because their prostate gets larger. That's not prostate cancer. That's a benign disease in the prostate. It's just an enlargement and obstruction of the urinary tract, but it has nothing to do with prostate cancer. So by the time men have the symptoms of prostate cancer, which is metastatic, meaning it's spread to the bones, they start having back pain, or if they fall, they break bones easier. By that time, it's already late. So it's very important to start screening early.
And so, is it different in nationalities? Or
it's higher in men, African American males. It's actually higher. It's actually 6.7 times higher incidence in black males compared to white males. And black males tend to have a higher, more aggressive disease at an earlier age. But men with family histories, regardless of the race, it's also a higher risk. So those are the 2 high risks: African American and males with family histories of prostate cancer.
Around what age group do you think it's?
Well, the recommendation for higher risk patients or populations is to start screening at the age of 40. Okay, and that's what is screening. Screening is checking a blood work called a PSA, a prostatic specific antigen, and a digital rectal exam, which keeps men away from the office. But it's so important because that 10 seconds can save your life.
The digital exam, that's the colonoscopy?
No, it's actually when the urologist puts her gloves on and checks your prostate through your anus, and he checks to see, or she checks to see, if there are any nodules on your prostate, plus a blood work, because you can have an elevated PSA, or you can have a normal PSA, but still have cancer. So we do both to increase the likelihood of finding cancers earlier. How do we find cancers? We do a prostate biopsy.
So, for instance, somebody's at 40 going to the doctor. Is it still, from the provider's standpoint, is that something where it's part of the exam at 40, or is that something where they're saying, hey, it's time, do you want to do this versus doing it?
Actually, there's a backdrop to that. In 2011, the U.S. Preventative Services Task Force, otherwise known as USPSTF, recommended discouraging men over the age of 70 and men between the age of 55 to 65. They also recommended possibly screening. But what we found is since 2011 to present, there's been a 3% annual increase in the diagnosis of prostate cancer. So it's actually increasing because less primary cares are actually checking these patients aggressively since that recommendation. So it's recommended that if you're high risk, starting at the age of 40, if you're not high risk, you might want to get a baseline at the age of 45, but typically annual checks and starting at the age of 50.
Your PSA, though, that's within the regular physical, right, that they provide.
It is within the regular physical for the most part at the age of 50. But the patients with high risk, a lot of those primary cares are not checking those patients at the age of 40.
Right.
So the incidence is increasing steadily, but it is increasing since within the last 15 years.
Wow. All right, Dr. Cordell, we're going to take a quick break, Destria, and we're going to be right back after these messages.